As the shutdown drags on, the Department of Veterans Affairs is already seeing cuts to certain services, but more could come. Shane Fordham joins us live in the studio with a closer look at the impact and what could be ahead if the shutdown continues. Shane.
Well, Janet, after 4 weeks into the government shutdown, certain services provided by the Department of Veterans Affairs have already been affected, but the VA says it remains prepared to continue delivering care to veterans. However, Hampton Roads residents and local veterans are concerned.
Our veterans need the VA, especially homeless veterans or mental health veterans, people that experience PTSD. The VA is our lifeline. They'll die without it.
Leslie Coggle, expert in political science department chair at Virginia Wesleyan University, says the Department of Veterans Affairs won't face funding cuts to the level of other federal agencies, but something she says the VA will experience as the shutdown continues are delays in treatment.
Even for benefits that are sitting there can be a delay in delivery or implementation. It could be incredibly hard to get in contact with somebody. And the longer that shutdown lasts, like the longer we're without the money to pay people, the longer this is going to last.
The Department of Veterans Affairs updated its VA Human Capital Contingency Plan in preparation for the government shutdown that began on October 1st. According to the plan, career counseling and transition assistance are the primary services currently affected, and the VA says that's not expected to change. But for local veterans, that impact is already being felt.
I was in the military, I was in the Navy for 6 years, and when I got out, not having that transition assistance program, I would not have known how to navigate finding work, how to translate my military skills into civilian attributes.
One veteran who asked to remain off camera says the shutdown and the hiring freeze impacting federal workers, including those at the VA, needs to come to an end.
They're already overworked. They're waiting for people to get hired. And not only are they not getting hired, but other people are getting laid off. So now you have a job that used to have 6 people is having 1 person. So the effectiveness of the work is going down and the people are getting stressed. And it's really just bad management. It's not a way to run a business or a country.
On their website, the Department of Veterans Affairs says the VA is committed to providing quality, consistent care and services to veterans, families, caregivers, and survivors. Shane Fordham, 13 News Now.
And the VA also says they will not allow any exceptions to their standard of care as the shutdown continues.